I am Dr. Charudat Jain Sambhaji, Manipal Hospital Goa, a consultant in endovascular and interventional radiology. So today we have launched the PERT program, or Pulmonary Embolism Thrombectomy Response program, along with the launch of an AI-based device which pulls out clot from the lungs. So we are actually addressing a disease which has very less awareness among the public, and even within the hospital system also there is less preparedness to deal with these conditions as compared to stroke, brain stroke, or heart attacks. So a clot which develops in the legs of the individual can travel to the lungs and cause sudden death of the individual, or the patient may require a lot of oxygen, lot of life supports, and the patient may remain in the hospital for an extended period of time. So these patients required to be treated or addressed a little more differently than what we have been doing for years prior to today. But today we have the Pulmonary Embolism Rescue Therapy team, along with the help of these AI-based devices. The one which we have is called Penumbra. So these devices, along with the team which is equipped to identify, decide a therapy, and also intervene, is able to deal with these patients a little more differently than what we are doing before. We are able to relieve their problems within a day or two. The patient is able to get discharged from an ICU setup to a regular room-based setup, and be able to discharge from the hospital within a week's time, where otherwise they would have stayed in the hospital for maybe 15 days to 1 month, and significantly reducing their costs over a period of time. So the technology, along with the team, is able to help these patients who have clot in their legs traveling to their lungs in much more effective and effective way than what we were doing before.
At a time, how many patients can handle?
At a time, this procedure requires the same machine which does angioplasties, which is called the cath lab machine. So we can handle as many machines that we have cath lab machines. So we have one cath lab machine, we can handle a patient at a time, and one patient can be done somewhere around in half an hour to 45 minutes. So much faster than what we were doing before.
So what are the early symptoms you can see in this disease?
So this is actually an acute condition. So you get symptoms suddenly. So patient suddenly feels short of breath. He may feel pain in his chest. And if the clot traveling to the lung is a lot more in burden, then the patient may even collapse, because a lot of blood is getting clogged in the lungs and in the heart, and the blood is not actually flowing to the brain, because it has to get oxygenated in the lungs and go to the brain. So the symptom wise, there are not early signs, because they are all acute conditions, and you may get a patient with all these symptoms much more in an acute manner than in a slow manner. But yes, a patient who has got swelling in the legs, if you identify them much earlier and do a scanning of the legs and find out that there is a clot in the legs, you can actually address this condition in such a manner that the clot doesn't travel to the lungs. If there is a chance that this clot could travel to the lungs, you could put an IVC filter and also remove the clot from the legs using a similar system or a different system, and clear off the clot and make them walk immediately. So when you have a clot in the legs, you have signs of clot in the legs, which could be pain in the legs or swelling of the legs, one leg usually. Then you see to that the patient doesn't mobilize. See that till a diagnosis is made, he takes bed rest and not mobilized from chair to bed, or doesn't make too strenuous movements, avoiding the clot from traveling to the lungs.
First of all, congratulations to आमचो Dr. संभाजी चारुदत्त, who under whose guidance आयज आमी एक नवी पल्मनरी रेस्क्यू टीम हांगा मणिपालान चालू केल्या, आनी आमी एक अशें मशीन आमचे कडेन आहा तातूंत जेन्ना पल्मनरी एम्बोलिजम म्हणजे जेन्ना आमी क्लॉट म्हणटा हार्टाच्या म्हणजे कुशीक जे लंग्स आसता, लंग्सान क्लॉट केलो जाल्यार एकदम डेडली म्हणजे 25% पेशंट पावत ना हॉस्पिटलान. सो तातूंतले जे पावतात ते आनी तांकां जर इमिजिएटली रिलीफ करूंक मेळटा तो सक करूंक मेळटा आनी टोटली ताका परमनंट ताका बरें जावंक शकता. इमिजिएटली तो ताजे ICU रिक्वायरमेंट कमी जावन तो बेगीन घरा वचूं शकता आनी ही कॅन बी फुल्ली फंक्शनल. दॅट इज इम्पॉर्टंट. फाल्यां तूं सगळें जर सकाळीं केलें आनी तूं आपलें काम करूं शकना जाल्यार कांय फायदो ना. सो ही कॅन बी नॉर्मल. हें कितें जाता पयलीं चॅस्ट पेन जाता सो आमी त्यो रूल आवट हार्ट आसा काय ना तें हें सो तुका टीम जाय वीच कॅन लूक इन टू दॅट मॅटर सारकें. कित्याक ते दोनूय जाण तशेंच दिसता पेन तसोच आसता. चॅस्ट पेन जालो खरस मारता हें हार्टाचें आसूं शकता, ब्रेनाचें आसूं शकता, लंग्साचें आसूं शकता. सो अशें जर क्लॉट आसा जाल्यार ते आमचे कडेन आतां तो मशीन आसा त्या मशिनानसून तो फक्त क्लॉट काडून यू कॅन बी टोटली ऑल रायट इन विदीन नो 25-30 मिनटाचें काम फक्त. सो इट इज इम्पॉर्टंट दॅट ते डायग्नोज जावपा जाय जाल्यार ताका तुजो एमर्जन्सी डॉक्टर आसा एनेस्थेटिस्ट जाय आमची जी ICU टीम आहा ती सारकी जाय आनी कॅथ लॅबाची जी टीम आसता हे सगळी टीम मेळून आमी आतां ती पल्मनरी एम्बोलिझम रिस्पॉन्स टीम म्हणून केल्या. सो दॅट आमचे तुमी जर ER पळयलो ERच्या कुशीकूच आमचे कडेन CT एन्जिओ करूंक मेळटा. MRI थंयच आहा मशीन. फर्स्ट फ्लोरार कॅथ लॅब आसा. सो कॅथ लॅबान आमचें सगळें ऑलरेडी तें मशीन सगळें आसा. सो एवरीथींग कॅन बी डन विदीन अ शॉर्ट पिरियड ऑफ टायम सो दॅट पेशंट्स कॅन बी टोटली सारके बरे जावंक शकता विदीन म्हणजे आनी परत फंक्शनल जावंक शकता आनी ओवर अ पिरियड ऑफ टायम तांचो खर्च एक्चुअली विल कमी जातलो.
कितले एप्रोक्स खर्च येतो?
ते कशें आसा न्ही तूं खंय रावतात म्हणजे तुजें जनरल वॉर्डान कितें आसा चार्जीस वयल्या वॉर्डान चार्जीस वील डिपेंड समथींग वील बी देर. सी एवरीथींग वेन द न्यू सिस्टम इज देर द कॉस्ट इज देर बट हांगा लायफ इज एट स्टेक. वेन द लायफ इज एट स्टेक आय डोंट थिंक वी शूड वरी अबाउट द कॉस्ट. एकदां तूं बरो जालो की ओवर अ पिरियड ऑफ 1 year तुजें यू वील सेव मनी एक्चुअली देन.